is regarding flexor retinaculum. So we'll know about the attachment of the flexor retinaculum as well as the structure which is passing superficial and deep to the flexor retinaculum. Flexor retinaculum is a strong fibrous band which bridges the anterior concavity of carpal bone or carpus and converts it into a osteofibrous tunnel called as carpal tunnel for the passage of the flexor tendons of the digits. We can see here in the diagram it is a rectangular and formed due to thickening of the deep fascia in front of the carpal bone. Let's know the attachment of flexor retinaculum. Can see here in the diagram it is known as radius. So this is known as lateral side, while this side is known as the ulnar bone. This is known as the medial side. So medially it is attached to the pisiform bone and to the hook of hamate. Same how laterally attached to the tubercle of scaphoid and to the crest of trapezium. We can see here in the diagram it is having two slips, that is known as medial superficial slip, also known as volar carpal ligament, and it is attached to the pisiform bone for the passage of ulnar nerves and the vessels. In the lateral aspect we have lateral deep slip which is attached to the medial lip of the groove on the trapezium for the passage of the tendons of flexor carpi radialis. Let's know the structure which is passing superficial and deep to the flexor retinaculum. The structure which is passing superficially, that is from the medial to lateral sides, are ulnar nerve, ulnar vessels, palmar cutaneous branch of ulnar nerve, tendon of palmaris longus, palmar cutaneous branch of median nerve, and superficial palmar branch of radial artery. So these all are the structure which is passing superficial to the flexor retinaculum, as well as origin of thenar and hypothenar muscles also takes place. Same how there are structures which is passing deep to the flexor retinaculum, that is known as median nerve, tendons of flexor digitorum superficialis, tendon of flexor digitorum profundus, tendon of flexor pollicis longus, ulnar bursa and radial bursa. Let's know the applied anatomy related with the flexor retinaculum. The applied anatomy, we can say carpal tunnel syndrome. It is a compression of the median nerve in the carpal tunnel leading to motor and sensory symptoms in the hand. So there can be so many causes. So causes are arthritis of the wrist joint and the carpal joint, dislocation of the lunate bone, old fracture of the wrist, soft tissue pathology, tenosynovitis, acromegaly, myxedema, then obesity also. Then signs and symptoms related with the carpal tunnel syndromes are feeling of the burning pain or the pin and the needles along the sensory distribution of median nerve, that is lateral 3.5 digits, especially at night. But there is no sensory loss over the thenar eminence because skin over the thenar eminence is supplied by palmar cutaneous branch of median nerve which passes superficial to the flexor retinaculum. There can be a weakness of thenar muscles also. Ape thumb deformity may occur if left untreated due to paralysis of the thenar muscles. There can be the tropical change, that is cracking of the nail buds, as well as there is a positive T-nails and the phalanx test.